back and buttock area, okay? So the first thing you're gonna do is you're just gonna sit on the foam roll, kind of generally like this, okay? You can kind of lean back and put your hands on the ground, and you're just gonna use that foam roll just back and forth in that lower pelvis area, okay?
Okay.
You're not going into the low back yet. We'll get to that, okay? So you're gonna do that, and then you're going to eventually pick a side. I'm going to start with this side. I'm going to straighten that leg and keep this leg bent. I'm going to lift up and I'm going to roll just slightly over to that buttock area. I'm going to start working that buttock area, okay?
Okay.
And you'll feel it and you'll know when you're done. And if you have a longer foam roll, then that's easier so you don't have to keep shifting around. But
Okay.
you'll want to just kind of stay with the foot elevated and rolling back and forth. Now you have the greater trochanter right here, which is a big bony protuberance. There's not really any muscles to work out there, so if you foam roll it, it's just going to hurt. So don't.
Okay.
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 Then you're going to allow your body to kind of slide down. So the foam roll is right here. Again, you're going to lift up, and you're just going to go from about the crease of the buttock to the posterior knee, okay, the back of the knee. You're just going to go back and forth like this, and you're going to go towards the side. And once you get to a certain point, you're going to have to bring your foot forward like this, and you're going to continue to roll back and forth until you work your way to your thigh like this, okay? And you'll work that for just a couple of minutes for the thigh, and you'll do that on both sides, okay?
Okay.
For the low back, you're going to sit in front of the foam roll, and there's going to be two positions that you take. One is going to be like this bowl shape, and the other one is going to be an arch shape, okay?
Okay.
They're going to do two different things. The bowl shape is going to work muscles. The arch shape is going to mobilize joints, okay? So as you're in this position, stay nice and square in the low back, because if you rotate a little bit, it's going to put a lot of pressure in the kidney area, and it's just really uncomfortable, okay? It doesn't give you any more benefit.
Okay.
So you're just going to roll back and forth like this. Okay. And then when you change positions and you're mobilizing the joints, what you're going to do is I start from the top and work my way down. And I'm going to start right where the ribs end, and I'm just going to extend back like that. Just for a moment, come back up, and I'm going to move to the next level down, right? You'll feel kind of about where that is. Extend back, come back up, move, extend back, come back up. So it's okay to have your pelvis touching the ground during that particular mobilization.
Okay.
And that pretty much works out the legs, the buttock, and the low back.
Okay. Awesome.
Cool.